We're going to take you live to Canberra, where the Deputy Chief Medical Officer is providing an update.
We now have almost 300 cases. That has risen quite significantly over the last week or two, and unfortunately now 5 deaths, all in elderly people. I'll make that point very clear as well. What we're seeing around the whole world is that for children and for young adults, the death rate is extremely low. And the serious illness in those age groups is also very rare. However, for people in the older age groups, and I would include myself in that, so people over the age of 60, they are more susceptible to this disease, and we are finding particularly in the much older age groups, 80 and above, that the death rate is actually quite high. So what we're doing today, this week, and throughout our response to this epidemic in Australia is trying to slow that curve so that we can manage those serious illnesses when and if they occur. So we're now at almost 300 cases in Australia, 5 deaths. In the global situation, over 160,000 cases, and overnight we reached a milestone there as well. There are now more cases outside of China than there were in those early days when the epidemic was only in China. So just a couple of other things to say in terms of what we're doing. So yesterday there were announcements by the Prime Minister. I was with him in that press conference when he talked about mass gatherings and the limitations on those, and we're working through what that means in terms of particular sports, particular events and so forth, so that we'll have much clearer information for people in the days to come, so that individual organisers, event organisers, event venues and so forth can make their own decisions in relation to those matters. The other announcement was scaling up of our border measures so that we're asking every person that comes back internationally from any country in the world to self-isolate for 2 weeks. Those were the 2 key areas that we talked about yesterday. This afternoon, myself, the Chief Medical Officer, Brendan Murphy, and the Chief Health Officers from all of the states and territories will be having a face-to-face meeting. This is the second time we've met face-to-face with the Australian Health Protection Principal Committee. We are now officially a subcommittee of the National Cabinet organisation, and so we will be providing specific information in relation to those public health measures and other matters to the next meeting of that National Cabinet, which is destined for tomorrow night. This is the second time we've met through the epidemic. We meet every day, of course, by telephone, but we find at these particular moments when things have changed a lot or new information has to be requires very detailed thinking and advice, we do meet together, 1.5 metres apart, of course.